Well, welcome to another episode of Insurance Gone Wild. I am your host, Dennis Settlemeyer, and my lovely co-host is
Stephanie Lencioni.
Stephanie Lencioni, right next to me here.
Yeah.
As always.
As always.
I've been trying to leave you behind, but
I feel that.
You just keep. Actually, if it wasn't for you, we probably wouldn't have any subscribers because, you know, you're easier to look at than I am. Of course, I do have the hats.
You do. You're very stylish with the hats.
I have the hats. Not so much with everything else, but with the hats.
I look at you all the time. I don't have a problem.
Anyway. Well, we're going to talk about something that's kind of fresh.
Very fresh.
Fresh in the news today.
Fresh, yep.
And it is the one big, beautiful act, which they used to call it the one big, beautiful bill. That's what's still in my mind. But it's actually been signed now. So the one big, beautiful act. And what in the world does that have to do with health insurance, right?
Everything. Turns out, everything.
Did they slide it in there, or was it?
Oh, I don't think that. I think it was very intentional.
Yeah, I think it was probably.
It was very intentional. Yeah.
You know what's interesting?
I don't think he was making any.
Throughout this entire process, I'm going to say a couple of things about the process itself of this. There must have been some things in there that really needed to be done that nobody had been doing because, yes, the Democrats went out there and kind of rattled their
cage.
They were doing their thing as they always do for politics, and the Republicans would have done the same thing had this been a Democrat bill. But it didn't feel like they were pushing back on it as hard as other things.
I'm shocked it went through as quickly as it did.
Yeah, I mean,
truly, he got elected this year.
Yes.
Or he didn't get elected this year, but he came into office this year.
Yeah.
And it's happened.
Yeah. It just surprised me that, because usually...
Right? Has that been... Oh my God, that feels like forever ago.
It's been
7 months.
January 6th.
Yeah.
January 6th.
Was it 6th? I thought it was 20th.
What?
Isn't it always the 20th?
I thought it was
Inauguration
the 6th because
day?
that's the day that wasn't it the day that they stormed the Capitol?
Yeah, but that's because he came out and he was making a speech because of the election situation and da-da-da-da-da. So it was the 20th.
How much I know about that stuff. But anyway, I was just surprised that it wasn't a louder voice from the Democrats. And it seemed like it was really more the Republicans Democrats are going to vote against it no matter what, just like the Republicans are usually going to vote against the Democrats,
right,
no matter what. But in the behind the scenes, everybody knows that the bill's going to pass, a bill is going to pass or not, right? Because unless there's literally a few people on the fence, but it seemed like it went through fairly quick.
I'm shocked. Yeah.
So anyway, that's my 2 cents on that. I am not a big political buff. Is that the right?
Yeah, I mean, I'll go with that.
Yeah, we'll go with that. But anyway, tell us how did this affect the health insurance industry?
Okay, so again, this is all very, very new. So just if things change, whatever, and this is a summary that I pulled from other sources and all the things. I have not read it myself, but this is just basically from what's been pulled. The biggest impact it's going to have are going to be the millions and millions of people who are on a healthcare.gov plan. Right. I mean, it is. So the way that it works, typically, like most of the people who are on a healthcare.gov plan, it's because they have a subsidy, right? Mm-hmm. And they may not have access to insurance through their employer and all of that. But typically, if that's the situation, or they're self-employed, but they're getting a tax credit, that can come in two ways. Number one, it can come in reduced premium, right? So which is based on household income as well as dynamics in the house. So a single person who's 26 is going to get a less of a subsidy who makes $50,000 than a married person with 3 kids that are 36 making $50,000 household income.
Sure.
Right. Okay. So then you say, okay, so the premium, the monthly cost every month is a lot cheaper and reduced, but then they also have this secondary element, which is called cost sharing. And that's where they actually can bring down, maybe you pay a little bit per month for the plan, but now they're bringing down your actual, you have a $500 deductible opposed to the $9,100. You have a max out of pocket of $1,500 opposed to $9,100. Does that make sense? So it's kind of two ways, all the things. what is going to happen now is it says end of enhanced subsidies. So the expanded premium tax credits from the American Rescue Plan and Inflation Reduction Act, they expire after 2025. So starting in 2026, smaller subsidies return, pushing average premiums back up 25 to 100%, which means that it will knock out a massive amount of people who are getting a subsidy right now to not even qualifying for it. Whatever people's opinions are on that, irrelevant. It's just what it is, right? So do I think there needed to be adjustments? I do. But again, how significant, what this is really going to look like, I don't know, right? So I don't know what the levels are for saying, hey, you no longer qualify for a tax credit altogether. Does that make sense?
Yeah, it's a little, it's a little scary, really, I think, for people that really do need it. There's got to be a new formula that they've put in there to help with that, and we don't really know everything about that just yet.
No.
But wow, that's
so health
that can be significant for certain households. Now we know there are people that are on it that they can afford it. We know there are people on it that know how to play. They play games.
They play the games. Did I ever tell you about the guy that I went to who, like, within the city limits, he had, which is fine depending on where you are or whatever, but in the middle of like where people are on almost zero lot lines, he has at least 3 acres. So you go in his gated entrance, like I had to get buzzed in, right? And then you look out the window and there's an Olympic-sized pool with a tennis court, a full basketball court, all of these other things. He paid $0 a month. And he was telling me how he dropped $100,000 cash on a down payment for his daughter's house in Colorado and
Does he do it because nothing's in his name? Is that how he does it?
However he did it. I'm not his accountant.
It's probably through a trust or something. And you have that kind of crazy stuff out there.
Right. And that's fine. I'm just saying, it's like, wow, I just remember sitting there. I'm like, this is... I feel like this is a broken system. And it is a broken system. Regardless of how you slice it, this is a broken system.
Yeah, and you've got people out there that don't even have a house or barely have a house that can't get the subsidy or can't get as big a subsidy.
Well, there is too low. So there is there's a floor and a ceiling.
Yeah,
right? Because if you're the floor, then you should be Medicaid. So it should be, what they're saying is it should basically be coming from a different government program, as that has already been established in place.
They just cut Medicaid by how much?
That I don't know.
$1 trillion or
Maybe.
something like that. It was some crazy number.
Yeah.
So what do you?
But again, and that's where I would say though. But what parts of Medicaid are we cutting? Why are we cutting? Which benefits of that? Because I think that's abused. And this is not to make it like a political conversation between us, but I think the whole welfare program is completely abused. It was supposed to be a temporary fix. You're down and out. Get on your feet and then let's go. But you're not skipping a beat. Kids are still eating. Everyone's still eating. All the things are happening. But now we have literally created a society where people are incentivized to not work because they're going to lose their free housing, lose their free food, lose their free. Yeah. So I'm just saying,
LBJ
like, it's been
type deal.
It's gotten out of control.
Oh yeah.
And so anybody who cuts it is now going to look like a bad guy. And I have not read it as far as which aspects is he cutting from Medicaid and from this and from that. I just know I think it would be hard pressed to find somebody who doesn't at least agree with, I think there's a little bit of wasteful money and wasteful spending. Now, how we cut and where we cut, then that we can disagree on that. And maybe people are like, no, keep spending America. That's fine too. But okay. So another thing that's going to end regarding healthcare.gov, no more automatic re-enrollments. So a lot of times I would get calls and they're like, hey, what do I do? What do I do? I was like, has anything changed? They're like, no, everything stays the same. Do you like your plan? Yes, I do. Okay, great. You're fine. It's just going to automatically renew you to the next plan and next year and all that. They'll send you new cards. Not anymore. And you'll have to reapply and provide information, documentation. If you're qualifying for a subsidy or if you're trying to, you'll have to basically reapply for that.
You don't know how that's going to affect how we get paid yet, do you? You're going to get to do all that for free?
they do pay agents now. Agents do get paid on it again. But there was that, it was a Tuesday. I just remember it. It was United Healthcare cut commissions down to less than 1% is what the email said. Less than 1%. They had the best product on the market though. And I had 7 family appointments that day. Yeah. Anyway, doesn't matter. What were you gonna say?
I was going to go on about United Healthcare, but I'm going to pass on that right now.
Yeah, some of those people end up dead. Income mismatch repayment limits removed. So it says effective for 26 tax returns, which is, so you're not really going to know what's going on until 27, right? Because it's after everything happens in 26. There will be no cap on advancing credit repayment if actual income exceeds projections. Meaning, individuals with fluctuating earnings face greater financial risk to repay credits received. So that should have already been implemented. Whether or not they were going back and doing it, I don't know. But I always tell my clients, I'm like, if it doesn't matter if you make $1,200 a month today, but if you, like real estate agents, right? Their income is so fluctuating. You may only need to sell 4 houses a year to have a really nice income. But that's not a house a month. You can't gauge that. So if you're low, and then you make $30,000, $40,000 December 31st, if that's on your 2026 tax return, they don't ask you when you got it. They don't care. They just ask that you got it.
Household income.
Household income.
That's what people need to remember, because we run into that.
We do.
Where they're like, well, my income was only X amount. Yeah, but how much did your spouse make? It's household income. So annual household income. If you had a subsidy based on a lower annual income, and then at the end of the year when you do your taxes, you're made a lot more then you have to pay back part of that subsidy. It's saying now that there's no cap on what you have to pay back, because there's been a cap in the past. I don't know what it is, but it doesn't matter right now. It's just that there is no cap anymore starting probably 2027. Or no, 26.
26. Yeah, the year of 26.
But you won't know it until 27.
Until you do your taxes
in January when you do your taxes.
Yep. Eligibility restricted for immigrants and special enrollees. So premium tax credits will be limited to lawfully present immigrants only. I'm going to say this. That I thought is what it was supposed to be in the first place. Maybe I'm wrong.
Well, you got California, specifically California, that's trying to offer it, or has been offering it to.
Yeah, and they have their
illegal
Medi-Cal thing, which is, and like, if the state wants to do that, that's one thing. But like,
government money though, it helps with that too. So fair. We got. I think they're just, that may be something. They're just like, look, we're got it on the books that we're not doing it.
Yeah, hard line in the sand and foot down.
So let me ask you a question. Maybe you'll get to it. Maybe you won't.
Who knows?
What was there anything in there about group plans, 50 people or more, those that don't offer it yet but should be offering it, like Obamacare says? Is there anything there about that?
I don't think, I have not seen anything on that.
Okay.
I have not done massive digging. There's just so much information that's going to start coming through the pipe, and then the carriers are going to have to figure out kind of what they're going to do.
Oh, it's going to be crazy. Your emails are going to be blowing up with information and webinars and stuff in the mail. It's going to be nuts.
So this says coverage loss, and there's some other things in there, but those are really the highlights of all of it. But and really the most important thing is the tax credits that are going to be the most highly affected. But it says estimated effects coverage loss. They project 10.9 to 12 million Americans will lose health insurance coverage by 2034. Approximately 4.2 million may be priced out of the marketplace due to higher premiums and tighter eligibility. So here's what that means. Oh, and then they say uninsured surge in health costs. Risk worsened outcomes up to 22,000 additional deaths per year. 2.5 million losing access to primary care. 1.6 million incurred medical debt. $1 million, in medical debt. Okay. Here's what I'm going to say. There are plenty of people who just don't have health insurance now. And it's not, it's either too expensive or they don't believe in it, or I'm young. What can happen to me? I'm invincible. That's already happening.
Mm-hmm.
There are other options out there. Now, for people who have serious medical issues, then yes, this could be a disruption. But if they are already lower income and they're on the marketplace, I don't know that they'll be super. It's that middle range. It's that middle range of people that are going to get affected, and I don't know what that looks like.
Here's a general overview of just my opinion. That's all it is, in my opinion, based on limited knowledge.
I love it.
It's not even a good educated guess. It's limited knowledge.
I like that. Okay, yeah.
But the United States is not just one big economy. It's a bunch of little economies put together. Each state could have multiple economies in it. So, for instance, it's more expensive to live in Dallas, Fort Worth, than it is in Paris, Texas.
Yeah, not France.
Right? Not Paris, France, but Paris. Yeah. So it's more expensive maybe to live on the East Coast in California than it is in
Central.
Kansas.
Yeah.
You know what I'm saying? So whenever you put
blanket
income numbers out there, blanket income numbers, and you say, okay, if you make more than this, then you don't qualify. But what if you live in New Jersey, where you need to make $500,000 to equal 100,000 or 150,000 in Kansas? You know what I'm saying?
And I'm with you.
I don't understand how that works. And I think that's where, again, my opinion, based on extremely limited knowledge, that how the money is spent needs to be up to the states. So. Yeah,
and I agree. Yeah, I don't disagree with that.
So the states can figure out how to divvy the money up. Same way with the Department of Education. It was a great deal. We're talking about politics.
I know.
It was a great idea when I think it was Carter came up with it. We had Bill Bennett, I think was education secretary for a while. He was a good guy. Both Democrats and Republicans liked him. We've had others over the years. But it had just gotten so big and so powerful that it had started taking away control from the states. I thought they should have blew the thing up 15, 20 years ago so that your local school boards and ISDs can figure out how to spend the money. Because
it's your community.
Education hadn't gotten any better. I'm sorry.
Well,
it has not.
So that would be the biggest issue, I would say. Like,
and
if we're talking about that one specifically, then it's like everyone's so...
And if somebody wants to argue with me about it, I can show them some resumes of people that I've gotten things...
They have college degrees.
Yeah, and they can't write, they can't spell, no punctuation. One literally looked like they had literally texted it.
Nice.
I'm like, are you kidding? So we have, because the teachers are forced to teach to a test. I'm talking about just government intervention in a whole. They have to teach so they can pass the test at the end of the year so they can get money. So they don't really teach the students everything. My kids went through school. There's a lot of stuff they don't. There's stuff that they do know, but there's a lot of stuff they don't know that I grew up learning. But having said all that, I'm going to leave that alone, and I'm going to go back to what you're talking about on the health portion. It is going to be very interesting to see the changes that are coming down the pipe. As it relates to health insurance. It's going to change again. Mm-hmm. We know it's going to change again.
It's basically a living organism. Like it just,
but
everything in politics.
When they were creating Obamacare, it was literally changing 3 or 4 or 5 times a day.
A
day. We'd get an email saying, hey, this is what we're doing now. An hour later, well, that's gone. Now this is what we're doing. And so, right, wrong, or indifferent is what we ended up with. And this is going to be a little bit of shock to the system, I think.
Well, it is. It's disruption, right? It's change. You're changing something. And anytime you change something, there's always going to be a disruption. It's kind of like, you've always heard, like, it gets worse before it gets better, right? So you're about to go in, you're going to make a change, whatever. Think even as something as simple as cleaning a room.
Mm-hmm.
Hey, I'm going to go in, I'm just going to go through everything in this room and I'm going to make it,
Mm-hmm.
I'm going to organize it and do all the things. Well, guess what happens when you start organizing a room? You're pulling stuff out left and right. And the room, you then walk in and it looks like a tornado just hit it.
Mm-hmm.
And then once you start putting things back and saying, nope, this can go. And that's just a very simple example of it, right? But
No,
that's what it is. There's going to be the chaos. There's going to be disruption. There's going to be change. And that's, there needs to be a change.
It could change again before the end of the year. It could change. It may stay the same until we get a new administration in. It's going to change.
Right.
It is going to change.
Right. But here's the thing, though. Anything hurts somebody. What you have to do, what I think should be done, is for the good of the country, right?
Mm-hmm.
For the mass majority of people. And then there have programs that can fill in those cracks where people, hey, I'm in this weird this. Is there something that I can get assistance? Like I'm not Medicaid, but I'm not this, but I do have this ongoing chronic illness.
If the market could get some stability, the market might create those programs.
Yeah. Okay. So here's,
because we're doing that on the PNC side. The market is responding with programs to some of these crazy deductibles that we're running into.
What I truly think the problem is. Well, I think there's a problem with a lot of things, but it's not going to get fixed until people start pulling away from true health insurance. And as the years have kind of gone by and different things and experiences, there's a difference between health insurance and health care.
Mm-hmm.
You can't, like, health insurance, you can have health insurance, but the insurance carriers, I'm here to tell you, most of them don't really care about the care. They don't. It's a business.
Mm-hmm.
Again, you want it to be a business and a profitable business, but it's a business. The doctors, we've talked about this before. They are all playing this roundabout game that who gets left behind and hurt the most? The patient.
Mm-hmm.
So the insurance company is supposed to be paying claims and doing right by the insured. They don't.
Mm-hmm.
The doctor is supposed to be doing right by the insured by being, reasonable in this and that and guiding them to what's best for them, opposed to whatever agenda they're being forced to push from behind. That's not happening. Like, it just, if it won't change unless people start stepping away.
Yeah.
And how do you step away? Well, there are alternatives. So, like, to your point though, that's why you do have health sharing.
Mm-hmm.
That is a deductible program, right? Like, hey, we're going to do a deductible reimbursement thing. Okay, cool. Hey, there's got to be a better way, guys. There's got to be a better way. And the health sharing, because it's faith-based, I think it was inspired by all of that because of certain things that were getting implemented in. And then, of course, you've got certain beliefs that you don't want medicine to pay for.
Mm-hmm.
But it's been around for a long time, but it's making waves. And it has gotten so much better throughout the years because it's also becoming more and more used and more common.
Mm-hmm.
And why is it more and more common? Because people are tired of spending the $1,600 a month in premium to still spend $18,000 for coverage. If they have to use it, $18,000 out of pocket.
Or was it 46 or something we talked about?
It was the $56,000 for the family. Now that was an expensive one, and he did have a PPO, but they're tired of that.
Yeah.
In the concierge service, there are a lot of doctors that are doing like direct, basically direct to care. And it's like
$100 a month. Come see me as many times you want.
Yeah. And they anywhere from, I've seen 50 and maybe they limit your visits to 150 a month.
Mm-hmm.
Right now, what are the negatives to that? It's not going to cover you for surgeries. It's not going to cover you for chemo. It's not going to cover you for these major things, but you've mitigated your expense. So if you can then find a plan that is more catastrophic, that's the other thing, is that they ended up taking away these catastrophic plans. So when Obamacare came into play, they took away catastrophic plans because they were forcing everybody to be on so they could get everybody's premium.
Mm-hmm.
For the people who are like, well, I can self-insure for $20,000, right? If something hits the fan, I can pay for that. But I'm betting against the fact that nothing's going to hit the fan right now, right? Like, I'm healthy, I'm active, I take care of myself. So if it's a car accident or cancer or then but that's an unforeseeable situation. Anyway, But yeah, you gotta, there's not, the health sharing is great, but then you do have to, unfortunately, it works best. You can get on there with pre-existing, but it's not going to cover the pre-existing, which most people want that covered. We're in a different place in the economy right now. Like there's so much changing that even people who are working for these big corporations, I would very much expect for either the employer's contribution to go down, meaning more is coming out of the employee's paycheck for the coverage, and or we are now limiting and reducing the level of benefits. So it's shrinkage. What is shrinkflation? Shrinkflation on coverage, and then inflation on cost.
We already got that on the PNC side, but yeah, with homes, like you're paying more out of pocket
for homes
for deductible
and
stuff like that. Yeah,
but they usually have been able to. I'm not saying every company is going to, have to pass everything along, but you've got the tariff situation that's kind of throwing people for a loop where it's the uncertainty, right? The big thing with corporations is we have to plan, and at some point they have to cut budget and they have to cut numbers somehow. And the two largest expenses in a company,
payroll is always one of them.
Payroll and insurance. So
yeah,
they go hand in hand. They can either cut your benefits or they're going to cut you. Not you, but people, right? Do they have to cut their workforce? So I'm just saying,
you're killing me.
I know.
Killing me.
So give us a call.
Give her a call.
But
let her know what you think at 817-753-0093. That is our phone number. You can also send us an email at contact at igwpodcast.com. Contact at igwpodcast.com. We've got a YouTube channel. We've got Facebook. We've got, you name a podcast platform. We're probably on it. You go to YouTube, leave a comment about this particular episode if you'd like.
You may be using a lot of characters.
Aim them towards Stephanie.
Yeah.
But
yeah. I don't get the internet on my phone, so it's fine.
No, she gets it. We just, as an agent, sometimes you just want to bang your head up against a concrete wall.
It's bad.
And we have to be able to understand this, to be able to explain it to people who have not a clue.
Right.
And I don't mean that in a negative way. They don't have a clue. It's so complicated. It's so complicated. So anyway, all right, guys, thank you so much. Join us next time.